people out there. Let's hit the agenda. We appreciate all of the public participation, and I want to reiterate the thankfulness of teachers, staff, and also our students and parents that have had to adjust to these last months of pandemic life. We made a motion, and it passed, to now have the discussion to the reentry presentation by Dr. Melton. So what I will do on the agenda, we are going to move, we're going to have that first, okay? Even though it says action is necessary on appropriate matters, but we will have questions and discussion, and then if there's any vote. So, correct. Dr. Melton, would you, well, I think you've anything you want to go back and say, or we'll just start with questions, whatever's good for you. All right, I will entertain questions on the reentry presentation by Dr. Melton.
Jan, point of order.
Yes.
Ms. Hammond, I'm sorry.
That's all right.
I think that we have the proper thing to do is have a motion before the discussion.
Oh, the motion of the, well, yes, is the motion, but we haven't had a motion yet.
Yeah, that's my point. I think you're supposed to have a motion before you vote, before you discuss, I mean.
Well, let me tell me if I'm wrong. I need Mr. White and Dr. Melton and Ms. Gardner and Mr. Lovis, since we've been. I was thinking normally, Ms. Huddle, correct me if I'm wrong, we have a presentation and then we ask them questions. And sometimes our questions have to do with where we want to make a motion to vote. Am I correct? I mean,
that's true. And,
thank you.
That's the way I believe it should go. I believe we should.
Because my
question.
question.
Superintendent is presented, and now we should have a chance to ask the superintendent questions. And then if there's any movement toward a vote on anything, there will be a motion. So I think you're right.
Thank you. All right, let's go back to, because I mean, I'm going to be the last with the questions. I'm sure y'all had some questions. I will entertain any questions. All right,
I had one. I just wanted to make sure, I mean, I understood what was presented because it's changed several times, but what was presented was that the first 3 days after the Christmas break, we would go into virtual school for those first 3 days. And then what happens after that, Dr. Melton?
Yes, sir. Mr. Levis, thank you for that question. We're trying to thank you. We got that slide pulled up. Sydney, I appreciate that. This is a visual to support the board so that they can see in response to Mr. Levis's question. Mr. Levis, ideally, I wish that we could say we would need Monday the 4th, but because of the closure for 2 weeks, I think that the recommendation would be distance learning for the 4th and the 5th and keeping Wednesday intact. I would hope that we're able to resort back to the operations that we've had for Thursday the 7th of January, but it's definitely will be an effect of what the data is for Monday the 4th and Tuesday the 5th that we collect. So it depends then on the will of the board as to does the board reconvene for an update of the data that we've collected for decisions regarding Thursday the 7th and Friday the 8th, or what might the will of the board be at this point. But I think we can't project and predict what data may be, but this is to give us an opportunity to position for what we possibly could do.
I mean, I guess what I'm asking is our plan to go back to hybrid, or to then go to 4 days, face to face, which is what we had agreed on months ago, and then all that, and then the data changed, and so we voted to do something different. So.
Yes, sir. So if I go back to this slide regarding the phases of reentry, on the 9th of November, we entered into phase 4 that brought back 7 through 12 to have 4 days of instruction. Then we, of course, adjusted for December the 7th for 7 through 12 to return. We are still, of course, working towards the February 1st of the 5 days that we've been talking about for phase 5. So depending on the information that we would have, unless the board were to take action to adjust, we would use the last motion that passed for the operations for December the 7th, of which we can find that in the minutes that were approved this evening. Ms. Gardner may be able to find that faster than me because she had as secretary, may be able to pull that. Ms. Gardner, can you help me find those from the minutes from
You're talking about
that,
from which meeting, Dr. Middleton?
when the board took action to have 7 through 12 adjusted for the
hybrid.
December 7th?
I thought it was the 7th.
December 2nd meeting.
Yes, sir. I'm looking for December 2nd. I pulled up the 16th of November, but I need to go ahead. So if I look at the motion, this is found on the last page of your minutes before Exhibit A tab, board members. Let me give you an opportunity to pause to read that number 2 that you all passed earlier from the minutes from this meeting. So that first motion, does everyone see where I'm looking?
I think I do. Oh, I'm on the wrong page. Approve the temporary plan put forth by the superintendent regarding an adjustment to the hybrid model for middle school and high school beginning tomorrow, or when the superintendent deems it's feasible, allowing distance learning on December 17th and 18th for contact tracing to be effective through winter break.
So then we would reset at winter break. So I'm asking now to adjust that Monday and Tuesday, and then we would resume back to the previous operations of Phase 4, unless there was a concern of the data that we collected on that Monday and Tuesday in January.
Ms. Gardner?
I would just like for you to step us through how you plan to collect data when we're not in school. I would like to understand how it's going to have to be self-reported, I suppose, or you're going to have teachers asking questions, or what's the plan to report when the children aren't in school?
Yes, ma'am. Of course, those parents that have been using email addresses that have extensions, of course, they can call our schools and leave voice messages during our closure. Emails, of course, would be something that we would collect, but then there's confidential information when it comes to a child's health. So I would encourage families to do what they typically have done. I suspect that many families would wait until we return on January the 4th to reach out to notify us because they would like to have a person to speak with. We have to, of course, be sensitive to contracts and responsibilities of our staff, that during the closure that we honor the contracts of which they work. If it's of interest to the board, I can have Dr. Turner and Ms. Stanek come to the microphone to answer any questions that you may have about that, if that's of interest for the clarification of the board, because during our closure of the holidays, we definitely need to make sure that our staff has the opportunity to, quite frankly, rest and recover. Is that of interest, Ms. Hammond, or?
Ms. Huddle?
Not that.
Oh, you have a different question. I'm sorry. Well, I would entertain the board's thoughts on that, or Ms. Gardner, since you asked the question, if you would like more explanation on it.
That answers my question.
Okay, that answers her question. Okay, Ms. Huddle.
I just wanted to clarify the reason that for the plan to move to virtual the first few days, is it because of concern of students being home at Christmas? Is that the reason, the rationale?
The winter holiday that we're going to be closed, of course, it's difficult to have a grasp of what may happen with staff, with students, of course, with their families. So it's difficult to anticipate. And as Ms. Gardner's question framed, how do we know the staff available to operate on Monday that day before? So are we going to have staff that are going to be entering leave Sunday night for their need to be out on the following day on Monday? And I just don't have the confidence that we're going to have the data that we need. Typically, on an average weekend, our staff reports their absences in compliance of board policy always. But with this closure, due to the window of time that we're going to have, it's concerning of what we may need to anticipate that we quite frankly cannot predict. It would be ideal if we could look towards that Monday, but I don't know that we would have the valid information that we would need to make decisions for operations on Tuesday. And of course, for our staff's preparation, if I look through Mr. Biedenbow's lens, he's looking ahead to ordering food, whether we're sending things home with students or feeding them in our cafeterias. So there's a variety of administrative tasks that we need to make sure that we're mindful of to prepare the staff for what to expect, and of course to communicate to our families for them to know what to anticipate.
I have a question. What is our, this sounds like maybe a question that nobody really could have an answer for, but just thinking positively thinking, why do we have to anticipate that we would have lots of people sick on Monday? I mean, I'm really trying to see, were we able to look at data, say, from the Thanksgiving holidays, and then what that percentage was? And so you're thinking Christmas is like an example for us to predict? Because, I was just thinking about, it makes sense to me. I'm not saying it doesn't make sense, but I definitely want to see how we make the decision that we could have that day, like say if the pandemic wasn't here and we just would come back on Monday after 2 weeks of vacation, and just positively thinking, how do we err on the side, I guess I'll say err on the side of that it's something we need to anticipate because it's more probable, I guess. We're dealing with problematics here, but tell me how you came to that decision.
Yes, ma'am. So if it were a typical school year, we had a winter break, we would expect to resume operations immediately. This, of course, is an added layer, and, for the board and the community to hear me say, I would rather be wrong than regret. So if I'm going to make a decision that ends up being the wrong decision, I will claim that recommendation that I was wrong, but I hesitate to regret making a decision because if we cannot successfully supervise and operate our school campus, it's going to create issues for our parents of how to coordinate perhaps on a Sunday evening or Monday morning. We may say on a Sunday evening we're concerned about school ABC and school QRS. And of course, I'm using acronyms of which we don't have schools. And then by 8 a.m. or 7 a.m. the next morning, we may have a different situation. So if it were a typical year of school operations, we, of course, would expect to fulfill the calendar that the board passed. But this, of course, is a time that is not as easily to predict.
And I'm getting this right, we would have, on our 4-day anyway, we would have Wednesday virtual. When you go back to 4 days.
Yes, ma'am,
so
until the February 1st week. Yes, ma'am.
We're really just causing 2 days away from the face-to-face to give you that pause, for lack of a better word, to be sure we don't have a Christmas vacation spike. And we would be able to, you would do the count for those 2 days so we would know if you had any fear of picking up. Because I think one thing I hear from the public is to keep changing. And I do know, and I've heard every board member sitting up here say that they are for getting back to 5 days. And I think what we just want to do is stay on task, for our plan, your plan, that we approved. And so I feel like if I know that we just have those 2 days, I think it's reasonable what you're asking for those 2 days. But I just want to be sure and I think this is the way to bring it up. I know there are a lot of districts where I teach, we look at a 10% of a school, if it has that many COVID in quarantine, then we close just that school to virtual. I don't mean close it, but that school goes virtual. But we just don't do it district-wide. So I just want to be sure we're not going to move the goalpost again. I think that's my biggest thing to worry about.
Yes, ma'am.
Mr. White?
No, that's an interesting question, Ms. Hammond, because somebody had sent me that, and that's actually your school district that does that, isn't it? Correct. Is that Lexington?
It's 2, Lexington 2.
Lexington
and
2.
One's going, they're 5 days.
And they said the formula was when the combination of confirmed cases and students in quarantine reach 10% of a class or a school, they would close a class or a school. I'm just curious, Dr. Melton, because I think what you're saying is you want a prudent approach and have some data so it's not more disruptive. And we've all heard the stories, our email boxes are full with the stories of disruption that the continuous quarantines cause. But I'm just curious what you think about, because somebody proposed that same thing that Lexington 2 does, but because that kind of says, okay, if people want to go out and social distance and not wear masks and not do those precautions, and you come back and you mess up your school, then guess what? It'll be just your school or your class that gets closed down. But what's your perspective on that? If that, I'm not asking to do that, but because Ms. Hammond raised it, that is an alternative that other districts are doing. And you're doing a more modulated approach, but I'm just curious what you think about that.
Mr. Wright, make sure I'm clear. Think about that.
The 10% rule.
Okay.
If you, what if we were to do what Lexington 2 does?
Well, I can't say with confidence what other districts do. I can say that there are frequent scheduled and impromptu conversations between especially districts in the Midlands. Of course, the staff and I have a variety of connections across the state that we reach out to that have similarities as us, but in the Midlands, we've had lots of conversations, so I can't say with confidence what neighboring districts are doing. I can say as a staff, one of the committees that we have reactivated that we had 3 committees during the reentry work during the summer, and then those 3 committees gave recommendations when we first started this work of reentry, and we've been using a different committee since then that became the reentry committee. We are reactivating a committee that is representative of those 3 and then some additional voices to include student voices. We've engaged our students through student advisory, but we're looking for students that may be elected by their peers and then others that we know have a voice and interest to lead and influence. And then, of course, we're searching for those right fit candidates, and I won't ask Mr. Giuliano to share the invitations that we've extended, but that committee is actually meeting on Thursday of this week for their next conversation. So if I were to draft for you where we are today, and I ask for grace, because I know as soon as I say this, it becomes the word as to what we're saying. So we have to have some trials to attempt the metrics, and then how effective are they? In a typical health situation, DHEC would advise schools and school districts to look at that 10%. But we're looking at 10% of absences because we don't know when a student is absent unless the family self-reports what kind of an absence it is. My child or grandchild may have another health issue, may have had surgery over the break, may have had whatever may have happened in the household or to that child. So unless we know the reason that a child is out, we can't tease out the absence. So if we're looking at a 10% absentee rate, but understand our days for attendance are not validated in that day of instruction. Our teachers have time with registrars to go back and update. Our families have time to send in the notes. You, of course, can't imagine us individually calling parents to let them know your child is not in school, but they do get a robocall, an alert that comes via phone to make sure that parents know that their child was recorded absent. Not that we would have any student that was expected to be at school that didn't come to school. But if that were to happen in some world, it alerts the families to know that the child was not present in school and or had a tardy to class. So if we're looking towards that 10% of absenteeism, that's going to be a metric that we're going to give a go-to see how that works. From a staffing perspective, I have challenged executive staff to give me a range. You can imagine, and I'll use Ms. Stanek as an example. If we have one Ms. Stanek out, that's 100%, and we don't have anyone step in her capacity because there is no number 2 that reports to her. There are nurses, but who does the roles of Ms. Stanek? If you look at Mr. Biedenbow or Mr. Wiseman, there's one of them, but they do have other staff working with them. So as an executive staff, we're looking at the range of 10 to 20%. If we have 10% of bus drivers out in one portion of our community, can we operate our transportation route successfully? Maybe or maybe not. Mr. Wiseman may say, yes, we've exceeded 10%, but I know that we can run the routes in this community. Or if Mr. Wiseman says, Dr. Melton, we're at 11% absenteeism. I can't run routes on time. Does that mean we're going to abbreviate and change the bell schedule for arrival? Does that mean we're going to send out a plea to parents to let them know we're having a transportation issue for tomorrow? Those of you that can assist us will help accelerate our delivery. So I regret giving you all that information, but I hope that brings some context to the what we're doing and the why we're doing. But we've not used a percentage of a 10% to a 20% of staff, but we have to look towards the specialties that our staff fulfills and the operations of safe supervision on our school campuses.
If I could, just let me make a request. Let's assume we get your reentry plan approved. Then what I would just ask the question, because I think you gave a lot of reasons why, but and the formula, somebody emailed me, and I'm assuming this is what Lexington 2 does, but we're going to have a dashboard that'll have this data, and maybe we use that dashboard as the place to measure. But what if, if you had to come back to us on the 5th and say the data's looking bad, what if we talked about a similar rule to Lexington 2, where if there's 10% positive cases and 10% quarantines, then that classroom, they shut down the classroom or you shut down the school. And that way, because one of the reasons that the person that sent this to me, they said, some of the schools are doing better than others. Some of the schools, people are following the mask, and we're hearing people in the public saying they're willing to follow mask. And there's some places that people are saying, I'm never going to wear a mask. We heard both sides tonight. And so if you're in a school where you're not wearing a mask and everybody's quarantined, then maybe you shut down the whole school, but maybe not the whole district. But I'm not saying we make that. I'm asking y'all to consider that. And then if you have to come back, hopefully all the data is good and we're going straight into 4-day and then 5-day. But if it's not, maybe consider an alternative that you can, if you think it works. But that's between now and January 5th, assuming there's a proposal here that passes.
And Mr. White, if I could go along with, because that is what we do where I actually teach. But also, and I checked before I came, Lexington 1 actually is in the 4 days, and they take Friday for their cleaning or whatever. So they have Friday, Saturday, and Sunday that kids are out, and they're going to go back to that. At least the people I talked to today, that was their plan. So I guess I was just thinking I can definitely see the reasoning. I think it's reasonable for these 2 days to let Dr. Milton's staff see that. But I certainly think, I just know as a teacher that we need to get back to face-to-face 5 days a week as soon as it is safe. And I do think that 10%, I think that's the CDC maybe recommendation. And I was going to ask you, is it the quarantine, didn't it get changed from the 14 days, Dr. Milton, to 10? Am I correct?
Let me ask Nurse Ann to come and speak to that. Of course, the CDC did make some adjustments. We received a DHEC alert. So, Ms. Stanek, if you could talk about the adjustments that we've made with our quarantines and our operational decisions.
Sure. So the CDC did, the day after our last meeting, changed their guidelines. And basically the summary of that is they still recognize the 14-day quarantine as the most effective way to control the spread. However, you have options to shorten the quarantine for operational purposes and that sort of thing. And so the way it stands right now is on your day 5 of quarantine, you can get a test. If that test is negative, you can end your quarantine after day 7. So a student that goes out, takes a test on day 5, if it's negative, comes back on day 8 because they have to finish through 7 days. For students and individuals that choose not to test, as long as they don't have symptoms, they can complete a 10-day quarantine and come back. There are certain situations where a 14-day quarantine would still be the best option. For example, if an entire classroom, let's say of like kindergartners, if they are quarantined along with their teacher, it may be best that they all just do the full 14-day. Athletics sometimes will also require the full 14-day because of the nature of the sport. So I don't know if that answered the question, but those are the guidelines that we're using. And we are implementing that. We started implementing that immediately once it was passed by the CDC.
Because my understanding was when we had to, have the special call meeting, you had so many out. A lot had to do with it did have to do with staffing, and they were quarantined. Didn't necessarily mean they had COVID, but it still was enough out. But there are schools that are making it, and it varies. I had a conversation with Scott Price with the School Boards Association. He said it really varies from community and school boards and the superintendent as how they handle it. So I think it's important that we answer all the questions that any of you have before we vote. Yes, Ms. Hines.
Thank you very much. So I appreciate the reasoning behind the 2-day distance learning at the beginning of January 4th and January 5th. My concern is always going to be, just like everybody knows, that we do need to be in school face-to-face, and the distance learning days are difficult. But I also realize that there needs to be a little bit of a compromise, and I would be willing to compromise on 2 days for the entire district. My concern is moving forward what that looks like on Thursday and Friday and the following week, and how many times our board has to reconvene to discuss reentry models. I'm glad that my colleagues have mentioned the compromise with having a percentage or some type of measurable of what it would take for the superintendent to be able to have the authority to make a decision on an individual school-by-school basis. So I know that that's not ideal necessarily. We are not educational experts. There's a lot that goes into operating a school, and I recognize that. My question to Dr. Melton, and really an open-ended question to the board for discussion, is if we were to set a measurable, say 10% of a 10% of the quarantined and positive cases in a particular school, which is not the same thing as the absences, outside absences of a student or really a staff member. If we were to do that, and we were to give you the ability to make that reentry plan on a school-by-school basis, depending on that situation. So for example, if one school has a 10% or a 15% positive quarantine, or quarantine and a positive number, if we were to give you that authority to decide that reentry plan based on that school, so that could mean that maybe at a high school is at 15% quarantine, and that doesn't necessarily mean that we need to revert to an all virtual model, where it may be that at a high school that a hybrid model would be more effective until we got that quarantine number down below 10%. I'm using 10% as a hypothetical number. Is that a compromise that would make you feel comfortable? Because at the end of the day, all of our decisions, this is a very difficult situation, but you are the expert on what actually works in the school, and I'm curious as to what your opinion is on that, as well as the other board members' opinion is on that. Is that a compromise that, the reason I'm asking is I am willing to make a compromise on those 2 days. I'm concerned that if we don't make a plan going forward, that on Wednesday, January 4th, 5th, 6th, that we'll have a special meeting to decide whether or not we are going hybrid on Thursday or Friday, or we're going hybrid for an entire group of schools versus one individual school. And that makes it really hard, I'm assuming, for teachers to plan going forward. I think it's important for all of us to recognize that there is not an easy solution to this at all. I mean, for the parents, for the teachers, I'm hearing from, there are teachers on both ends of the spectrum, there are families on both ends of the spectrum, and what I don't want to do is to find ourselves in a situation where we are not supporting our district as a whole and we're not working together. So I'm hoping, and I'm hopeful from the discussion from other board members that we can reach a compromise, but that ultimately, I want to know if that's feasible for you, or I'm deferring to you.
I was looking at Chair Hammond to
Yeah.
see if she, okay. So first, if I may just insert, I regret that there is an appearance by some that feel like that there is a divide or not support of the administration, and specifically me. This board has shown an interest to learn because of their concern and because of their desire to know information to contribute to the operations that will keep our communities safe and our children learning. So Ms. Blackburn-Hines, I appreciate the opportunity that I can assert that, and I'm careful about word selection because to me, compromise may lead, politically, there's a reason for that, but when I think of compromise, I could see someone inserting, you're going to compromise my health, you're going to compromise my well-being, you're going to compromise my social emotional well-being. And regardless what side of the opinion that you're on, because this apparently is one side or the other, there really are not people in the middle. But I would argue, doesn't it make us better to listen to the other side? And the questions that this board have asked via email, by phone conversations, by physical interactive conversations, and meetings just like this, I would hope that people would see the level of detail and attention has improved because of some questions from this board. I don't know that I would say compromise. I would say comfort, that we're confident that we can execute at this place, but I may come back to you next time and say, okay, 10% is not working. And if that's the case, I would ask that this board and this community give grace and understanding with, they've done 10% before with other, I think Ms. Huddle has referred to as contagious diseases. So if there's an absentee rate, is it solely about COVID or is there an outbreak of the flu or strep or whatever else? So I have to, as superintendent, I have to make sure that I insert the well-being of our community and their physical health in addition to COVID-related incidents, because we could also see a surge in absenteeism if other things were to have an outbreak or a high infection rate of something different.
Mr. Hogan.
Yeah, Dr. Melton, to kind of spin off of what you just talked about, would it be safe to say that we could calculate medically excused absences versus just absentees?
Mr. Hogan, I'm hesitant to answer that because our excuses, I would not want to deter a parent or a guardian from sending an excuse because they may not have the details that we need. And if a student, because of our operation Wednesday, Thursday, and Friday of this week, if a student is absent, is disengaged from instruction this week and is cleared by their medical professional to return, I don't know that we're going to have that of record. The quality of our information is as successful as the input and the reporting of our parents and our families. So I don't know that I can say with confidence because that would create an additional layer of input for our registrars and our clerks that do the reporting for absences. And then that may lead to a return to a parent or guardian of, you don't have the information we need, so we're sending this back. And then we may never get it back to actually record it as an excused absence. So I'm hesitant to agree to that because it would be disruptive to our process of how parents send in excuses. It's a difficult time of the year to reset expectations when we've done such a push to get ready for a successful year of communication for this year.
Another question? Sure.
More. Sorry, Dr. Melton, one more. We've talked a little bit about a 10% number, and I want to question, is that a fair statement to say 10% across the board per school when we are looking at certain situations where in elementary school and the way the classes are structured, a positive case would quarantine an entire class? So looking at the data, looking at particular schools such as, I'll say elementary school A, has a population of 528 students, but currently as of the most recent data, there's 42 students in quarantine, 3 with positive, so it's putting it at a 9% quarantine rate. Is that enough to justify triggering a change at an elementary school level where the cases are more consolidated?
Truthfully, I don't know. I think that operationally, I hope that our elementary staff would agree. And I think this gives me the pause to say what a tremendous job our staff has done. Facilities of the reset of physical environment and the new expectations that every staff member has contributed to. So, Mr. Hogan, I don't know that I'm comfortable answering that with confidence, but I hope that we can make individual decisions based upon a school. And for one additional layer of information that I'm mindful of, reporting of this kind of information is also indicative of available quality health care. So if we see schools that may have high poverty, that may have lack of availability of healthcare resources, let's be sensitive that it may not be about a percentage, but we need to investigate to see where are our children. Because if a parent does not go and have the testing or have the medical professional to diagnose, there may be a child that's ill that is out, and we think they are out for an illness without knowing that it's COVID. So that's why I'm sensitive to say, if we're making it solely based upon COVID, that is indicative of quality health care being available, as opposed to absenteeism that we need to monitor. So your COVID dashboard may show one piece of data, but meanwhile, we're monitoring on a day-to-day input into our power schools, a different set of information. So what is our daily attendance rate? What is our daily absentee rate for our staff and also for our students?
Ms. Huddle?
I have a question about the State Department of Education's rapid testing program. I went on their website, and right now it shows us in an undecided status. So I wanted to find out, are we going to participate in that testing program? And if so, have we decided how we're going to use the testing program?
Yes, ma'am. Thank you for that. I'll ask Ms. Stanek and Dr. Harris both to assist with this. School District 5 has not responded with commitment. We're looking to see what kind of training does it require of our staff, what kind of cost does it incur for disposal, how is this going to be an additional level of responsibilities on our already overextended nurses. Ms. Stanek or Dr. Harris, what would you like to add to that for context?
I can say, honestly, my concerns with it is nursing staffing to carry it out. Our nurses are working really, really hard. They're working long hours. They're working on the weekends. The weight that our nurses are carrying right now, handling the positive cases and the quarantines and everything that goes along with that, and the data collection, adding another thing on their plate is going to be very heavy. And so honestly, that is my concern.
Can I ask a follow-up? So what are the requirements if you participate, that you have to test certain students or certain numbers, or, or can we test whoever we want to whenever we want to?
Right. The way the test is designed, it's designed for symptomatic people. So it's definitely not a screening tool. So it's not as if we could just screen everyone as they came in to make sure they're negative. It's designed for symptomatic people and will give you the most accurate result if it's used. So it is for students and staff who are having symptoms.
Okay, so if they're having symptoms, they're supposed to go to the nurse, right? Mm-hmm. So is it I guess I've been tested, so I'm wondering, is it really that big of a deal? I could understand if you were having to randomly test people, but if the student or staff's already coming to the nurse saying, I've got symptoms, is it that much work to go ahead and test them while they're there?
It does add work. There is the element of reporting. We have to now come up with a reporting system for all positives and all negatives. Every test we do has to be reported, so we'll have to come up with a system for that. We would have to, the person after they're tested has to wait for 15 minutes on their results. So each health room has an isolation area, but depending on how many you're testing and that sort of thing, do you have enough isolation in place to accomplish that? We would have to come up with a biohazard management program and the cost and just the running of that. So it's not as simple, and I'm not saying it's completely, but I'm just saying it's not as simple as just swabbing a nose and moving on.
I gotcha.
And Ms. Stanek, if I may add, it also adds a layer of outreach to our nurses, of conveying information of a positive or testing that was required parent or guardian permission. So we already have some parents that are frustrated when nurses are calling them. So imagine if a nurse were to call and then the parent were to say, well, test again. I've heard of others who have had 2 and 3 tests. So it adds more of a distraction from the work of school nursing. So if that's of interest to the board that we pursue that, we likely would seek what other personnel might be able to assist because our nurses are stretched thinly.
Yeah, I was going to ask that. Have you considered, and asking us if you need the funds, but getting assistant, temporary help, temporary nurses or help to do that? And I guess, and I understand, and maybe a policy, you get one test, you don't get more than one test. You go to the urgent center if you want more. But I guess I could just really see the value of knowing at least, I understand there's some false negatives, but once they start showing symptoms, that tends to even out. And it would just be really nice for everybody to know, and maybe it would reduce the quarantines.
Of course, it would take the qualified personnel to do that, and what personnel would be allowed to do it. We are having difficulty finding medical personnel to substitute for nurses. So if we had to take a priority of which do we prefer to have qualified available people to substitute as nurses, and then this would become the secondary need of some of the testing needs that may happen. I've seen the demonstration of the test, the number of droplets that you have to secure to put into the area of vial for testing, and it would definitely be a distraction and could be time-consuming depending on the size of the school and the number of students that may need assistance.
And I guess just a follow-up to that, and you may not know how insurance programs work, but is there, I know DHEC does the free testing, right? Is it rapid?
DHEC's testing is not typically rapid.
Okay.
It's the antigen that takes typically 24 to 48 hours.
Okay. So if a student or the parent of a student wanted to get a rapid test, right now they would probably have to do it in a private physician's office and pay for it because they have to be seen by the doctor, right?
Right.
Okay. Just put out there that I'm a little concerned that people that don't have the means to do that won't get tested.
Thank you. Dr. Milton, do you have the numbers of now that we're on the, I hope, nearing the backside of this pandemic, do you have the numbers that are still in the virtual in 5 versus the face-to-face? Do you have that? I didn't ask you. It was just curious to see as we move forward.
Yes, ma'am, I believe that is in your board brief.
I know, and I thought I saw it, but I don't.
That is the last 3 pages of your board brief from this time. Dr. Harris, do you happen to have that memo available, or either Mr. Holden, if you could come up to speak to that?
Because I know we ask, how many that, ask for the hardship to come back into, and I guess we've had some from face-to-face move to virtual. Yeah, here it is.
Director Holden, if you could speak, board members, if you'll look to the last 2 pages of your board brief that I sent to you, that's included there for your review, and Mr. Holden can answer any questions that you may have.
So it is,
can answer questions, or either we can follow up depending on the questions.
well, I was just thinking before we make our vote on the change, it is a great number. It's 318 that have come back to face-to-face, right, from the 5, or from virtual, I should say.
You're referring to the elementary students who
Yes,
previously requested
elementary.
a change?
Excuse me. Yeah, that's what I was reading. I didn't tell you elementary. And then on secondary, it was,
These are
it's
numbers,
only,
Dr. Harris.
is it 58?
And we're still in the process of processing our secondary requests. Those, of course, go into effect on February 3rd, but we're working through those. Dr. Harris has that list available for us tonight as well,
Well,
the numbers of students who have already been processed as part of that, as part of our hardship request.
Right. Well, I don't want to, since we are belaboring the point, I just thought that might enter into some of our, as we're looking at getting back to face-to-face. But even if whatever we do on the vote tonight, correct me if I'm wrong, the virtual can stay there all year, right? I was just trying to think about the number.
Yes, ma'am. 5 is in existence for all
For the
year,
all
and
year,
then that,
okay.
of course, is up for discussion later this evening so that the
Yeah.
board can contribute to that
Okay.
planning for the coming academic year.
Okay, Mr. White.
I just wanted to reiterate, in terms of this vote, to have 2 virtual days, but reiterate what Ms. Hines says, it's not so much we got to keep coming back for special call meetings, but all these people over here who need to be devoting their attention to operating the schools in the district. So we're putting additional burden on them. So I'll go back to, is there something that, assuming a vote would pass, is there something else we can offer besides having to have a special call meeting on Wednesday if the data doesn't look good? I mean, that's, because otherwise we're dragging everybody
Yeah.
back.
I got you. I think that's a good point. Maybe, I would entertain Mr. Hogan. I think we talked about this. Do you have a motion? I think we've talked this to death. If you've got a motion, we could place Mr. White's, we could place the 10% in there,
So,
which would not allow, in other words, we'd give her a percentage, and if it's there, she doesn't need to come back to us for that. And really, I'd like it to be school by school, for sure, because it is working. All right,
And-
Mr.
did you have a question?
All right. Yeah,
Okay,
Got it.
he has a question before we better go to a motion.
Just one thing, I mean, I guess the protocol would be that if it were 10%, then you'd go back to hybrid, and then if it were 20%, you'd go back to virtual. I mean, we haven't talked about that, so what are the,
So,
That's,
you know,
Commissioner.
Yes, sir. We were looking at 10% depending on what the need may be. So if it's 10% and we think that we could operate effectively in a hybrid model, then I would suggest that we adjust one step down so that we have the opportunity to step back one scale. If we see that it's much higher and we're concerned that we can't operate hybrid effectively, then it may be a virtual. Now, the disclaimer on this slide that I pulled up that has the asterisk, schools may utilize 100% distance learning model during any phase if needed in response to COVID-19. Phases and dates can be modified contingent upon reentry considerations. So we've tried to make sure that we've included that in case there is an adjustment that was necessary. But
okay, so we're gonna go one step down, and and if we have to do that again, we're gonna go another step down until we get.
I would hope, yes, sir. But if it were severe, I don't know that we could, if there was a high percentage, I don't know that we could operate with confidence one step down.
Okay, if we were operating at 5 days, and, which we hope to do, then if something happens, we go to 4 days, and then if that if there's a problem, and then we go back to a hybrid, is that the method that we're talking about?
Ask me that again, Mr.
I
Levis.
mean, if, we are all hoping that in January that we go to 5 days. I mean, that's what it says. So
Yes, sir,
then if-
February 1st, yes, sir.
February the 1st.
Yes, sir.
Okay, so we're going to go to 5 days. Okay, then if there's a 10% problem, then we step down to 4 days? In that one school, I'm talking about, I understand that we're talking about not the whole district, not one size fits all. So is that what we're talking about, and
Yes, sir, the options are open. So if the board were to say for the confusion of families, it's either, and I'll use the February 1st week the way that you're using. So if that's the example that I were to use of the week of February the 1st, the board may say, let's rely on that asterisk that we said before, that you go either 5 days or you resort to distance learning. If the board were to say, if you can operate, we prefer hybrid for that particular week, then we could adjust to that.
so the point is that we're trying to give you leeway where you don't have to come back to the board for every particular instance. Okay, so what I was trying to ask was, okay, if we have that scenario and we're at 5 days, then do we go, are we automatically going to hybrid, or are we going to 4 days, or are we going to virtual? I mean, that was the question.
We could do any of those. Now, if this board has an interest to do one over another, then that will become the priority. If you were to say it should be either 5 days of on-site or virtual, that's what we've been explaining to people. But this current operation that we've inserted, the hybrid return on December the 7th, that was not originally in our plan. But we felt like if we stepped back one, rather than resorting complete virtual, that we could be successful. So I hope that it shows that we're trying.
I understand what
Yes,
you're
sir.
saying. I just want to make sure that it's clear where we're going with it. Okay, now.
Ms. Hines? Ms. Hines?
So I kind of want to speak to what Mr. Lovelace is saying and kind of clarify what I was thinking about this, in the sense that 10% number, in my mind, I see it as, and I see the motion that could be made referencing a 10% number, but once it hits that 10%, say we have a 10% school of quarantine and positive cases, it hits 10%, then at that moment, it triggers where Dr. Melton has the opportunity, the authority to, for that one school, decide what that reentry plan is. That could be nothing at all. It could be reentry, it could be virtual. I say that because there are currently schools within District 5 that have a higher quarantine rate above 10%, and they are operating effectively on a hybrid plan, not a virtual plan. So, and I believe that there may be schools that are above 10% that are currently operating on a 4-day plan, and it's working, I'm assuming, because it hasn't been brought to the board for a special meeting. And if Dr. Melton had the authority to make that decision per school, it may be that the schools, I would rather her be able to say, okay, this school, I'm seeing what's happening within this school, and let's monitor it. We don't have to make a decision right now. Or let's decide to go to hybrid for that school because that's what's working for that school. At that point, she has the authority, we give her the authority to make those decisions based off of the metrics that we were giving her tonight, so that we don't have to have a special call meeting. That's how I saw it.
Ms. Gardner?
Yeah, and I agree wholeheartedly. I've been begging for us to have a benchmark since August, and I'm glad that we're talking about this because it does remove the ability for us to make decisions based on the way the wind blows. Because I don't think we want to be making these decisions. We want it to be this is the guidelines and this is what we do. But I would say this because of what I've been watching other school districts, because that's what we do. I like the idea of giving Dr. Melton the ability to decide what that looks like, because just for instance, I just found out that Dorman's going to school 5 days a week, and they had to shut down for 2 days or 3 days or something, and then they went back after they cleaned and quarantined, and then they went back. So it didn't have to be, oh, we're going hybrid for the next 4 weeks. It was just a couple of days to reset. So I would like to allow her to have that opportunity to decide per school basis whether it needs to be a full hybrid, whether it needs to be virtual, or just a couple of days of virtual to reset. So, but I would be in favor of her having that decision. So,
Mr. Hogan, if you've got that all down, I figured you might make a motion.
yeah, you got to make
I
a good
don't.
motion.
We can get a second and
Mr.
discuss.
Hogan, you know you have
So
a
I move
motion.
that we give the superintendent the ability to make a decision on reentry on the individual school-by-school basis when the district data exceeds a 10% quarantine and positive caseload
Per school.
per school.
All right, and that was a motion. Will you read it one more time?
I move that we give the superintendent the ability to make a decision on reentry on an individual school-by-school basis when the district data exceeds a 10% quarantine and positive caseload per school.
And I see a second from Ms. Hines. And then the person that made the motion, you want to speak to it first?
I think we've covered it.
What did he say?
Could
He
we,
said, I think you've got it. All right. Now, any other question? I didn't look this way.
could we make it, I think you said positivity, but I don't think you said student. Could we add one word?
You want to make a friendly amendment?
I do.
Because we had a second, so it's on the floor. So,
I move that we amend to insert the word student in there, wherever it goes.
do I have a second? I have a second. And so let's have a vote on that amendment. So,
Well, can we talk about that?
yes, we can talk about
So is that removing teachers from that quarantine and COVID positive number, or is it, what does that mean?
Well, it would, so
Okay.
you have to think about that, and we can discuss that. I will say, in comparing the school-level data, there's no real connection between what's happening with students and what's happening with teachers, which kind of leads you to believe whoever's getting it from whoever's probably not happening in school. So I'm a little hesitant, but I also know that there are staffing issues, so maybe it should be, either is 10%.
Ms. Hines?
I would say that it should include both students and staff, because one of the reasons why we were brought to the meeting last week was because of staffing concerns. And, I mean, that's why we were brought last week. So I would think that in order to give deference to Dr. Melton to make that decision, like I said, she could make that decision based upon school by school. And if she doesn't have a staffing issue, the teacher number doesn't really matter. Maybe it's that there's a higher student quarantine and there's higher staff in the building, so the number doesn't really matter and she doesn't have to adjust on reentry. If we start limiting her on the individuals that we're talking about in the building, then I'm concerned that we will have to revisit this issue when there is a concern.
Yeah, that was not my intent, actually. My intent
Okay.
was, it's either or. You know, you don't have to sum up the teachers and the students and divide it by the teachers and the students. It's if either the student ratio is over 10% or the staff ratio is over 10%. And then she would have the flexibility to take whatever measures.
Let's get your motion, read it like you had said it, and then we're gonna, the amendment, I wanna see where that goes for us to vote.
The original motion?
And then,
I move that we give the superintendent the ability to make a decision on reentry on an individual school-by-school basis when the district data exceeds a 10% quarantine and positive caseload per school.
so it doesn't say student and/or. Do you think it needs to? Let's take the vote on that. Just leave it as is. Those for the motion, all those in favor of the motion, raise
Wait,
your
can I?
What are we doing? Are we
don't I-
voting on the amendment or
We have
just
to
the
do the
motion?
amendment, yes.
We're voting on the amendment to.
That Ms.
okay.
Huddle had, and it was to
Can I
add.
read-
Can you clarify your
Can I
amendment?
restate my amendment?
Yes,
Instead of where the district data, so take out district data, where the percent positive plus quarantine students exceeds 10%, or positive plus quarantine staff exceeds 10%.
okay. We've had, okay, Mr. White?
Wait, was that a motion you made?
Yeah, it's been said, it's an amendment to his motion, and we had a second, so we're discussing it.
Well, I'll make a second, then I got another discussion, so I'll make a second too. I know we're gonna sit here and whittle this thing down to.
So you have a different motion, so we gotta vote on this one.
Well, I just think, I think we're sort of hitting the principal parts, but the one piece that needs to be added is we are approving her to go virtual for the first 2 days, and then this trigger starts. You know, she's got to have the
Yeah.
data for the days.
Yeah.
So we got to add that piece, and so that she's starting on to come back on the 4th, the 5th, and on the 6th, she has the discretion, she has the data to make decisions school by school.
Unless, and I don't know this, unless this motion is to not do that. I mean, and it just
I
be.
think
by the-
that would require another amendment.
Well,
Yeah,
I
and
have a
can I just,
All right,
Can I
let's get
say
this
that to Ed?
discussion over with first, of this,
I
of
feel
the
like that should be a
amendment that's Ms.
different,
Huddle's.
yeah, that should be a different motion completely.
Okay.
This is about,
Okay.
about allowing Dr. Melton to make plans for the
Gotcha.
district, not about those 2 days.
But right now, we got to decide about her amendment to this motion, so we
Right.
can go back to the motion.
Right.
So
It
it's
has,
been
it
said,
has.
all right, all those in favor of adding the worded that
And/or
Just-
students to.
and our students and staff, raise your hand for yes. And that's 7-0. Now, we are back to the original motion, Mr. Hogan. We want to vote on that now?
the original motion.
Can I call for the vote on Mr. Hogan's motion? All right, all those in favor, raise your hand. 7-0. Those opposed, none. Now, what next do we want?
I would like to make a motion to support Dr. Melton's reentry plan for for distance learning, Monday, January 4th, Tuesday, January 5th, and to continue the existing distance learning on January 6th. Right?
Oh,
January
that's
6th?
Wednesday, excuse me. I thought
Wednesday,
that was-
January 6th?
you're right. But, well, we need a second before we discuss.
Wait a second.
All right, second, Mr. Hogan. Ms. Hines, I have a question. Should we not add to that following that Wednesday?
Well, based upon the
Based.
motion that was just passed,
Yes.
if on Thursday or Friday or next week or 2 weeks from now, if Dr. Melton sees the numbers and determines that she needs
The
to make a
10%.
change at an individual school or schools, then she will have the authority to do that based upon our motion. So I don't want to overstate our motion.
I got you. because I was thinking about we
As
definitely
of
went back
right
to the 4
now,
day.
her plan suggests going 4 days on that Wednesday, or that Thursday and Friday.
Because that is her plan.
That was what she
Yes,
suggested
that's
to the
her plan.
board.
Ms. Gardner?
I just want to speak to what might happen on Monday and Tuesday because there won't be school for these kids in person. I don't think it's going to be easy to track the actual cases. So there'll be a delay in reporting. And I also feel that it will encourage a lot of our families to travel longer. And so I'm concerned about making those days distance learning days because of that fact. Because I'm not going to lie, the first thing I thought, because I love going to Disney World, y'all, was, ooh, it'll probably be cheap to go to Disney World. And I went, wait, I can't do that. That would be irresponsible. But that was my first thought. And that's what I'm concerned about because I know I'm not the only one that thinks that way. And so I'm just saying that I would prefer us to come to school on those days and assess. And those would be assessment days. We can cut ourselves a little slack on those days. We can do what we have to do to get through, because it's like that anyway. Any teacher will tell you those first 2 days back are horrible anyway. And so it's just going to make Thursday and Friday horrible instead of Monday and Tuesday, and then we've kicked the can of figuring out the numbers down the road, and then we're delaying our decision-making abilities even further out, because then we'll have to assess if we are at that 10% mark and which school needs to be worried about. I'm concerned with not going to school face-to-face.
On Monday and Tuesday.
On Monday and Tuesday.
Okay. Ms.
Said my piece.
Hines, you want to speak to your motion?
So I respect that opinion of being concerned about families going on vacation and those days not being utilized. However, what I would say is has to be a plea from our board and from our school district to encourage personal accountability from our families. We are trying really hard to be comfortable, not compromise, be comfortable with the reentry plan. And that requires the support of everyone, of our families, our teachers, our communities. This is not an easy decision for anyone, and everyone, I would really stress that. I know that there are a lot of strong opinions about what's going on. I share a lot of those strong opinions, but I also understand that my opinion is not the only one. So I would really stress that. I would also say that that does give the ability for the parents. I mean, we're saying this to our community. We're saying, if you don't feel well, or you're quarantined, or you've been tested positive, or if our teachers aren't feeling well and they've tested positive, on that Monday, Tuesday, and Wednesday when you are not in that building, please tell us, reach out to us. And I know that everybody's not going to listen, but at some point we all have to be involved in this, or it's not going to be successful. I also have concerns of my own about our distance learning days. I understand that. I think some of our teachers are struggling with that on both ends. Parents and students are struggling on both ends. This is not an easy situation. I have to figure out, I don't want to make this about my situation, because that's not my role on this board, but I will say, I am a parent. I am a working parent. My child is in elementary school. And that week is very hard for me to try to figure out what I'm going to do. We are all going to have to, I recognize the challenges that this presents. So I'm just throwing that out there.
Ms. Gardner?
I just want to echo that I completely agree with Ms. Blackburn-Hines. So if we're going to ask our parents to step up, then we can ask them to step up before reentry on Monday. We can ask them to be responsible during the time that they're gone or out of school, and we can do the same thing. We can say, will you be responsible over that weekend beforehand? Try not to travel, and if you are, be very mindful of who you've been around and quarantine and whatever you need to do. But I don't think we have to wait till Monday to ask them to do that. I think we can do that ahead of time, and they'll step up, and so that we can. We need to be in school so we can assess the numbers. I truly believe we're not going to know the numbers if we're not in school.
Are you interested in making a motion to that?
So can I?
Yes, I didn't even look this way. That's terrible. I'm sorry, Ms. Huddle. But I saw Ms. Hines' hand first, but I had not turned this way. We are so
Okay,
spread out.
Me or her?
I'll let you, I haven't even looked this way, so I need to be fair.
We need to
I'll
put
be
a
back.
different
Ms.
swivel.
Hines, I'm not slighting you.
It's
We'll
okay.
put a different swivel on your chair. So,
Swivel.
I'm just kidding.
We need a buzzer.
We can move it for you.
My understanding is that we're concerned about kids being around family members, et cetera, over the holidays. But I'd like us to look at the dates, okay? The two days we're probably most concerned about are Christmas Eve and Christmas Day. That's when you're around all the family members, and then it might be a few extra days, but for most people, that's all you can tolerate of your family. I mean, maybe y'all have families that are different than mine. I remember my mother-in-law used to after 48 hours, she wanted us to leave. So if you count forward, and there's lots of studies, and I realize that there's no two cases are the same, but it's pretty consistent that the average time from exposure to symptoms is 4 to 5 days. Numerous studies show that. And so if you count forward, it means that if you're exposed on December 24th or 25th, you're going to have symptoms by December 28th or December 30th. The current schedule gives you 3 days to get rapid testing. And so I would just like to make that point that I don't think this is necessary for safety. I agree with Ms. Gardner that my concern is, okay, we need a hashtag about safe at Sonic because it's not true. Drive by Sonic on a Wednesday and see all the high school students hanging out. Go to Seven Oaks Park or Crooked Creek Park and see all the kids in daycare crawling on each other. So I'm concerned that all we're going to do is exacerbate the problem and that we have plenty of time to see the symptoms and for people to get tested.
Ms. Hines.
As Dr. Melton stated, and I believe this is true, I think the reason behind the Monday and Tuesday dates are that, well, first of all, I'm going back a little bit because I'm building on what Ms. Huddle said about Christmas and Christmas Eve and those being the 2 big days. We also have New Year's Eve, which is right before the week that school starts. And I know that there are several big parties planned around our area for New Year's Eve. So that is a concern that we have to kind of keep in mind. And also when it comes to the plea for families and teachers to contact the schools and self-report their quarantines or their positive cases or what have you, we don't have the staff in the building until the 4th. Because of the way that our contracts are written and the fact that our buildings, as far as I know, will not have that staff for folks to call in. So those 2 days, it gives the ability where we don't bring somebody in who may not realize on January 4th that they were exposed on New Year's Eve, but maybe by January 6th, they do. And there is not a perfect solution on this. I'm not a doctor. I'm not a doctor. I don't know all of the specifics, but I do understand that if we take a couple of days to make sure that we don't bring everybody back in the building that has been exposed on that New Year's time frame, then we lessen the risk of those excessive quarantines and having Dr. Melton have to shift those plans, which is difficult for teachers and for students. So that's just my thought process on that. This is not an easy.
For the lateness of the hour and some things we have got to cover for Dr. Melton, we have some leeway with other things. If listening to your motion and then listening to y'all's concern, if there's a motion let me say this and I'll take, if there's a motion toward any of your thinking, this is the time for it. If it's not,
Well, this motion has to be voted on.
Yeah, I know, but I'm just trying to pull the thoughts of you two, which are a little different than yours, and we only know how the board feels if we do a vote. But your motion's on the table, right, Ms. In a second. But did you want to talk to her motion?
To her motion real quick.
Okay.
I think we need to vote on this motion because
I do too.
the exceptions are taking away her original request, and I think this motion is to say, she came to us, she gave us the rationales as to why they need those 2 days to gather data and get assessed. We gave her flexibility. Let's don't back up and lose sight of what she asked for originally. And that's where I think we need, I think we, if there's other things people want to do, let's vote on this
Right.
motion first and see
Right.
if it passes.
I agree. So we'll call, I think I can call for the vote, right? All right, all those in favor of Ms. Hines' motion, does anybody need it read again, since it was so long ago? Okay, I think we know it. All right, all those in favor? 1, 2, 3, 4, 5. Okay, 5. And those opposed? 2.
Can I ask a question?
Who said that?
Can I ask
Yes.
a question? And I know I believe that there may be a concern that was just raised to me that there is a conflict within those B days. If there was a situation, because the B days in the high school and the middle schools have been out, that if we pass this, does this mean that the B days will not have been in school in person for 3 weeks? And if that's the case, so the way that I read the motion that we have just passed is that as of now, we go back to school, or no, we do distance learning Monday, Tuesday, and Wednesday, and then we go back 4 days
Starting
as
Thursday and Friday.
needed that Thursday and Friday. So everybody would be in school that week on that Thursday and Friday. If there is a situation where the B days, where on that Thursday our high schools need to revert to a hybrid, is there a way to address that for that 1 week, where maybe that Thursday is an A day and that Friday is a B day? I don't know, and it may be a situation where we don't know that, and we're going to have to roll the dice about that. I just want to acknowledge that I'm
That's
not
a
the
teacher
teacher. I don't
thing.
make the schedules. I'm just trying to acknowledge that I know that. So,
Dr. Milton, I'll let you.
the cohort. Sorry. I know I'm not the
excuse
teacher.
me, I know as a teacher that's not easily done,
Right.
what you're explaining.
Okay.
It's a teacher thing, it's a curriculum thing, and I'll just take that. It'd be really hard for them to do, and I think that's why there are
Okay.
board members on here that want to,
I apologize to that B cohorts.
all right, guys, we
Ms.
got to
Hammond,
move on.
For my clarification, Ms. Hammond, the report that Mr. Presley gave regarding athletics, does the board need to take action on that, or I just want to make sure that I'm operating within compliance of expectation of the board?
I had a question on that. I don't want to make it, don't present it again, but there's not a problem. It sounded like the sports where they were inside sports, they were going to be, there's a certain amount of time before they can get back together. But if it's an outside sport, they're going on with their practices. Is that correct?
I'll ask Mr. Presley to respond to that, and I also will add the layer of, we have definitely been mindful of Title IX. This board has reviewed Title IX updates in the last couple of months, so in addition to the thoughtfulness that Mr. Presley and team have done, no pun intended, Mr. Presley, with team and athletics, but making sure that I am deliberate to share that there's also a layer of Title IX awareness in addition to this recommendation.
Correct. Making certain that the teams are treated equally, male or female, that they're getting treated the same way. When fall sports came through, a good example is you have girls golf and girls tennis. So as we consider our spring sports, we have to make certain that we allow our boys tennis and boys golf the same opportunities that we offer the girls and boys. The girls in the fall.
What about our, like our cheer competition that's coming up? That nothing's affecting that.
No, ma'am. Winter sports will close out.
Okay.
And that will, not winter, excuse me, fall sports will close out. Fall sports season ends with the state championship for
Right.
cheer.
Do we need a vote on this, Dr. Melton? What do you think?
In the past, Ms. Hammond, the administration has adjusted athletics as needed, but out of transparency, we tried to bring it forward so that the board would know. I know that's been of discussion to the board and concern, of course, the well-being of our student athletes. So this is for information to the board unless the board chooses to take action since this was part of the report.
Okay. Mr. Lovelace, any of you? Ms.
No, I don't have the.
Okay, I think we're fine with that. I think the last time, I think it was a good point brought up by board members that, academics, should be equal to sports for sure. But if there's not any need, if there's no one that's having any problem to have a vote. Oh, Ms. Hines?
I just have a question, and I don't think we're voting on this.
No,
because it's
we're finding out,
I just
though,
have
she
a
said we
question
might need a vote.
about, just to make sure that I understand what you're saying. Really, this impacts practices over Christmas break. It does not, it's short-term,
Correct.
a definite period of time, and principals and coaches and administrators have, they are in agreement, and it's in compliance with any other high school league rules, if there are. I'm just curious.
Yes,
Because
ma'am.
I know that I'm not necessarily in favor of, it doesn't matter because it's not a vote. I'm curious as to what it means with not having the practice, and that it's a definite period of time, and it's at the beginning of the season. Is that right?
Well, we're already in winter season,
Okay,
and the principals, athletic directors, they all agreed that they wanted to suspend sub-varsity teams from
Okay.
practicing and conditioning in the gymnasiums and enclosed spaces. So
Okay.
the only teams that will be utilizing the gym will be varsity, basketball, and of course wrestling.
okay,
Spring sports, varsity, if they are conditioning in the outside spaces, they can still continue to do that for spring sports.
okay.
And they're not in season yet, so it would just be conditioning and utilizing the outside spaces.
Okay, and is this for the winter holidays?
This is just for winter break.
Okay, thank you.
We have 14 on here, and I know y'all been waiting for this one. Appreciation bonus for staff. Oh dear, I'm skipping something, but I'm excited about this bonus thing. Okay, we do need, action is necessary. Look back on our executive session, and I will entertain a motion on these items. It'll be A, B, D, and E. Okay, Ms. Gardner.
I move that we approve selected employment items for Exhibit A and employment matter regarding hiring for Chief Finance Officer and Executive Director of Operations positions as shown in D and E, with Exhibit C for discussion of negotiations incident to proposed contract amendment regarding growth forecasting and redistricting services by Malone and McBroom. Well, okay, sorry, I have to clarify this. I thought we had to say that we were approving all of them at once and then we had to remove them. Is that not true? I don't have to do that? Let me start over then.
You can start
I'm
over.
going to start over.
Sure.
Okay. I move that we approve selected employment items in Exhibit A. That's where I stop.
Just, we taking them one at a time?
Yeah.
Okay, is there a second? Mr. Hogan seconds. All those in favor, raise your hand. A, selected employment items. 1, 2, 3, 4, 5. And those opposed? 1, 2. Okay. Let's take we are not taking B since that was information only. Okay. So I would go for D. Item D. Okay. Hit the green button. But your his microphone died. And they're new.
I'd like to make the motion we approve Item 3D, employment matter, Ray, hiring for Chief Financial Officer and Executive Director of Operations positions.
Is there a second? Ms. Hines seconds. Any discussion?
Can I make another motion?
Well,
An amendment?
you can make an amendment to the motion.
I'd like to amend the motion that we approve the hiring of the Executive Director of Operations, and we defer the hiring of the Chief Finance Officer.
I'll second. Any discussion? Mr. Lovelace?
I think that we need to look into the matter to make sure that the person that we're hiring is a certified public accountant and has an accounting background because of the nature of the job that they would hold.
All right, we'll have a vote on the amendment. Does anybody need it reread? Okay. Yeah.
Please reread it again.
I move that we approve the hiring of the Executive Director of Operations position, and we defer the hiring of the Chief Finance Officer position.
Okay, and we've had an amendment and a second. So all those in favor of that amendment, raise your hand. 4. Those opposed? 1, 2. Well, then, Ms. Gardner, I didn't count you at 3. Excuse me. It was 4-3. Okay. We need to vote on E, don't we? Right,
I
okay.
move, can I make a motion?
Yes, you sure
Okay.
can.
I move to approve a contract amendment regarding growth forecasting and redistricting services by Malone and McBroom to provide one additional scenario so that we will have a total of 2 scenarios that address only creating an attendance area for Piney Woods Elementary.
Is there a second?
I'll second.
I see a second, Mr. Lovelace. Any discussion?
Yes, I just want to make sure that the amount of money that we were talking about for the second scenario, as quoted, was $5,000.
I think it was actually a total of 10, and I left that out to leave it to the discretion.
Well,
of
we
the-
already had one, scenario left, which was 5,000.
Right,
In our existing contract.
right.
And so what we were going to do was add one additional scenario at 5,000. So I think that was what we discussed.
Ms.
I
Gardner?
think, well, and I agree with that, except I think we have to add more money in because we have to have more board meetings over it, and they will have to present. So we might just have to cap it at 10 if we can, or negotiate 10, or however
Yeah,
we
we
want to
did
write
talk
that.
about maybe a little bit more than 10, just because of what you said.
They'll have to
So,
have meetings and things
Yeah,
like that.
personally, I'd be fine with that. I think it just requires an amendment.
Amendment.
Can I speak to that?
Yes.
I think that in lieu of coming back to the board for another round of discussion on this, that we would allow up to 10,000, and that way, if we don't spend that, at least, we won't have to come back for another vote on the same issue.
Did you have an amount in there?
I did not, so I believe that would be a motion for an amendment by Mr. Lovelace.
All right, you're gonna put in the 10,000 and be an amendment to her motion?
I couldn't repeat what you said.
You just have to state the amendment. I don't think you have to restate that.
I would like to amend the motion to put the sum of $10,000 maximum in there.
Is there a second for that? A second for Ms. Gardner. All right, on that, shall we, put a limit on that of $10,000? Yes or no? 1, 2, 1. Are you up? 1, 2, 3, 4, 5, 6. 6 to 1. Okay. Or did you hear that, Mr.?
Repeat that again, I'm sorry.
Okay, I'm sorry, you missed it. It passed, though. No, it was just putting a number on the motion from McBroom of
Yeah,
$10,000.
no, I'll support that.
7 to
Yeah.
0. Okay.
I've
What
got a
else before we get
question.
to the fun
We
stuff?
still have to vote on
Okay.
the emotion. We only voted on the
Oh,
amendment.
your amendment. I tell you, y'all's amendments, that's why it's so late. Okay, all right, now we're back to your original motion. You want to read it again? It's been a while.
Yes, and we've got the 10,000 limit now. So move to approve a contract amendment regarding growth forecasting and redistricting services by Malone and McBroom to provide one additional scenario so that we will have a total of 2 scenarios that address only creating an attendance area for Piney Woods Elementary.
Good. All those in favor of that amendment, raise your hand. And that's 7 to 0. Yes, Mr. White?
Did we voted on the amendment on the CFO and the Executive Director of Operations, but did we vote, was the original motion there or just the amendment? Did the
Your
did the
original
amendment
motion was
subsume the
both
original
of them,
motion?
right?
What's that?
Your original motion was, you voted on approving both of them, right?
And there was amendment to it,
Yeah.
and so the amendment
And the amendment passed.
subsumed. So my question is, what are we going to do for budget in January? How are we going to create a budget, Dr. Melton?
Well, according to Dr. Melton, she felt she had qualified candidates.
I mean, she can still
I mean,
leave
you
the
can
budget
explain it.
in there. There's not, we approved the position. We
Yeah.
just didn't approve.
Right.
So she can still put the budget.
I don't know how you address that, however you want.
Well, first, I'm cautious because, of course, the confidentiality of this. So, Mr. White, I would say the administration needs an opportunity to be prepared as to what the plan will be during transition, and I will update the board accordingly.
All right. Thank you, Dr. Melton. Okay, now,
Just so that, can I ask a
What
question?
else?
Just
What
to be, Chairman,
yes,
just to be clear, this now means that as we go into January, we don't have another board meeting until January 25th. We will not have a CFO. Is that, based off of this motion, is that correct?
I guess that's right. Okay, appreciation bonus. We really are to that point. Dr. Melton, do you want to address that?
Yes, ma'am. We have a quick presentation this evening for the board that's included with the packet for this evening. I'll ask Mr. Richardson, our Chief Finance of Operations Officer, to come to the microphone. We've entitled this Appreciation Bonus for Staff. School District 5 has had the history of loyalty bonuses, and upon conversation with board members, we have renamed this because, of course, we're in a unique situation of COVID operations. The board, of course, has approved my priorities that were in conjunction with my goals for this academic year that have been consistent during my tenure as superintendent. I, of course, have focused in earlier this evening on priority 5 of the safety of the social, emotional, physical, and social and emotional work environment. My apologies. So with these priorities in mind, we want to continue to work on our strategic plan. And, of course, maintaining, retaining, and recruiting qualified candidates to School District 5 and keeping them employed in School District 5 is always a part of our first priority. So looking on these 5 priorities, we brought to the board an update regarding our recommendation to the board after listening to the board and hearing interests of ideas, other conversations, and administration with our review. Ms. Richardson has tonight's presentation. Mr. Richardson.
Thank you, Dr. Melton. As a reminder, since this is going to be a non-recurring expenditure that we're coming forward with, I wanted to remind you what our board policy says about our reserve funds. And I'll just draw your attention to the last paragraph where it talks about our general reserve fund should be somewhere in the neighborhood of 15 to 18% of our general fund budget expenditures. And for the current year, no, I'm one slide behind, excuse me. But anyway, I want to give you a reminder, I guess, of what we've done in the past 3 out of 4 years with bonuses to our employees. Back in 2017, we had a $500 bonus that was paid on November 18th, which was the Friday before Thanksgiving break. I think in 2018, we did not do anything. Back in 2019, we also gave a $500 loyalty bonus, which was paid on November 20th, which was right before Thanksgiving break once again. And then again, in last year, in April, right before spring break, we were able to give our employees another $500 loyalty bonus. This brings us back to where we are now, and our current general fund budget expenditures are $196,524,672. And as Mr. Hodges told you tonight, our was part of our audit, our unassigned reserve funds as of June 30th, 2020 is $43,344,184. On the upper end of that requirement of our board policy would be at $35,374,441. The appreciation bonus would cost us approximately $3 million. It's actually going to be a little less than that. Mr. Shealy and Ms. Frick have been going through all of our employees to make sure we've got them all listed, and right now it looks like we're going to be somewhere between $2.8 and $2.9 million that we'd pay out. One thing I did fail to mention is this year we are asking for a $1,000 bonus for our employees, not $500 like I just showed you previously. So after that $3 million, our unassigned reserve funds would be $40,344,184, which is still above our board policy requirement. It would put us at about 20.5% of our general fund budget. And that concludes my presentation on the $1,000 appreciation bonus, Dr. Milton.
Thank you so much, Doc. I know that's appreciated. And we got to have a motion before we talk about it. Okay?
I'd like to make the motion that the board approve a one-time employee appreciation bonus to all employees employed as of 11/30/2020 of $1,000 per employee.
Is there a second? Second, Ms. Huddle. Now discussion, Mr. White.
I was going to go ahead and vote on it.
I
Ms.
just have
Hammond,
a
if I may
question.
interject, we want to make sure we say permanent employees. Ms. Richardson, would you make sure that we insert that, that's what we've done in the past, is permanent employees?
That's correct.
So I don't know if,
That was said in the motion.
Well, all I did was use the same wording that Mr. Richardson had in his.
We want to add.
We
it.
can do
But
an
that's fine. I
amendment.
mean,
Do we have to make an amendment? Or can we
But
just-
I have discussion first.
Yeah,
Is that
sure,
possible?
sure.
Because it actually goes to that point. Is there any major class of employee, bus drivers, janitor, custodial, cafeteria workers, is there any major class of employee that this would leave out? The permanent?
No, we've tried. Anybody who is in a position in this district will receive it.
Okay, so
In other
no-
words, temporary employees would not.
Okay, but it pretty much,
everybody else, yes, ma'am.
Okay, all right, I move to amend the motion to state in, a $1,000 bonus for all permanent employees.
Okay, it's probably that's safer. And I have a second to that, Ms. Gardner, thank you. All right, all those for that amendment that we put permanent into the 7 and 0, thank you. All right, good. Then you
We still have to vote on the motion.
Still have to vote.
Just, when you do these amendments for me, it's late. Okay, now, the original motion. All those in favor? Two hands, yes. 7-0, it passed. Thank you. Thank you, Mr. Richardson, for finding all that for us.
Yes.
We appreciate you. See, you're leaving us. All right, partial suspension of administrative rule, IKAR grading assessment systems. Your own, Dr. Melton. Number.
okay, yes, ma'am, this is for action this evening. Mr. Giuliano, of course, brought it last time for discussion with the board. So if there's any questions, but we're ready for action unless there's a interest for the board.
I'm good with no questions, but anybody else? Okay, well, I entertain a motion for that to pass. Mr. Lovelace?
I'll make the motion under item number 15 on the action agenda, the partial suspension of, I move that we pass partial suspension of administrative rule IKA-R grading/assessment systems, Exhibit I.
I have a second. Second. Mr. White seconds. All those in favor? 7 and 0. Okay.